Welcome to In Focus on ABC 10. I'm Trent Bailey. Executive orders, health concerns, and restrictions are forcing many events, including fundraisers, to be canceled throughout the state and country. As a result, several organizations are now struggling. I recently spoke with Kevin Storr, the executive director of the Portage Health Foundation, about what they're doing to help nonprofits and others in the community during these trying times. Here is that conversation. Enjoy. Thank you for joining me today, Kevin. You want to tell people that are watching a little bit about who you are and what you do with the Portage Health Foundation?
My name is Kevin Storr. If you don't know me, and back in 2013, I had the opportunity to become employed as the executive director of the Portage Health Foundation. For those that may not know, Portage Health Foundation serves Baraga, Houghton, Keweenaw, and Ontonagon counties, and our mission is to make this community a healthier community through enhancing philanthropy and charitable contributions that address health needs and health risk needs in and throughout our community.
Right now, there's everything going on with the COVID-19 crisis, and I know that you guys have done a lot, especially what you kind of rolled in from last year with the Father's Day flood was the Copper Country Strong, and there are still resources available if you go to the website there. You want to explain a little bit about what Copper Country Strong is and how people can use that today?
Well, the Copper Country Strong came about more from the community and not necessarily from the foundation in 2018 as a result of the Father's Day flood. And what happened is when the COVID hit, we started having some conversation with the Office of Emergency Services Manager here in Houghton County, Houghton and Keweenaw County. And Michael Babcock, one of the members of our staff, spoke with them about creating a centralized source of information. So the resource that we provided to help that was just simply allocating some time for Michael to work with the emergency services managers from Houghton, Keweenaw, Baraga, Ontonagon counties, as well as Gogebic County, and along with our health officers, and to essentially reinvigorate the Copper Country Strong website and to get the content updated and a website updated so it could be used as a centralized resource for our community for information sharing. And what we've been trying to do over the last couple of months now with that website is just to simply utilize that as a centralized source for communication and updates. There's a volunteer resources site, there's a donate site on there, and then just updating information as it's coming from, whether it be from public health or through the governor's office on matters that are current and relevant to the COVID crisis. So, we believe in a lot of, not just in that case with the Copper Country Strong, but in general, one of the most powerful resources you can have available to you in this time is good, accurate, factual information. And we wanted to do what we could do to not only, to help make sure that that information is being conveyed. Another thing outside of the Copper Country Strong website that we've done, and probably the biggest role that we've played at this point, is just the role of a convener. So we've been able to participate in a number of other community-wide calls that have worked with the multi-sector leadership in terms of business, health, public health, education, and whatnot. And we've also served as a host for a multi-sector nonprofit sector group of community partners that gets together every week and talk about some of the issues that we're seeing, some of the concerns that we have, but we've really tried to maintain a solution-focused conversation within that group, and that's been really powerful for just information sharing, resource sharing, and allowing those groups to connect with one another, truly in a spirit of solution-focused conversation and supportive mindset.
And that's something that we're seeing a lot is people coming together to kind of find solutions or provide resources for people. How did that sort of start, these meetings that you're talking about, where these organizations are coming together and start meeting to help out the communities?
Well, I'll speak from our perspective. A couple of weeks before this really broke out, we started having some conversations internally as well as with our Office of Emergency Services, and started having some conversations with Kate Beer from the Western UP District Health Department just trying to anticipate, what likely are we going to see as a community. Um, and then when, in early to mid March, when the, stay safer at home order came through and the schools were canceled, we immediately thought, we really need to make sure that our community partners are coming together, to share that information. Again, that's a valuable commodity, is good information. And by, what we believed is by getting everybody together and participating in these calls, what's going to happen out of that is we're going to be able to share information. We're going to be able to, share some of those challenges and not have to carry the burden of those challenges alone, as organizations often do. And to make sure that there's other people that are contributing to that conversation, again, to find solutions or offer resources, or just to make sure that we're all looking at that problem with the same information. And so we started convening, sent an invitation out to about, I think it was initially 31 different people. And we've been hosting these meetings ever since mid-March, every week, and have had upwards of 24 plus participants on those calls, every week. And again, just sharing content. And it's been extremely helpful. Again, just in identifying support systems, resources, supplies, financial resources. And just this morning, we announced, one of our funding partners, Jim LaJoy and the Superior Health Foundation, is launching a new COVID recovery loan or relief program for nonprofits. So that information was being able to be put out right away this morning. And, and another way that we can support, that partner organization through information flow. So, that's just one of the things that we've always felt is very important, is really just making sure that our community has that information availability, and that's best done through those convenings.
I wanted to ask you about the Community Recovery Fund. I know that's something that you guys created, I believe it was back in mid-March or late March there, to kind of help out organizations and stuff like that. Do you want to talk about what that fund is being utilized for?
Yeah, I can do that. We had, again, we had a couple community donors contact us right away in the beginning and say, how can I help? I'd like to contribute some financial resources. How can I do that? And we pledged to them that if they wanted to use the foundation as a conduit for that contribution to go into our community, that we would accept that as a deposit, and we would make sure that 100% of their donation went back into the COVID recovery. So, as part of that, we created on our website a specific landing page for our COVID community recovery loan or fund, that people can donate to. And we have collected, to date, we're actually just this afternoon are working to reconcile that. We actually launched a new platform with the reporting is a little different, but we're right around $13,000 have come into that so far in COVID donations. And to date, we've used that to help with some of our emergency food services. For example, we provided 31 backpacks, which is an emergency backpack food program for school-age children, with $5,000 of support. We provided $2,700 in support for the Ontonagon County 4-H backpack program. We had about $2,900 in support that went to senior meals to help them with their food delivery systems. We acquired 10 gallons of hand sanitizer from, actually was a donation through Iron Fish Distilleries out of Lower Michigan, Thomasonville. And they donated that through us to our community nonprofits that we've distributed. We've acquired 2,000 masks that were distributed to our community nonprofit partners. And then in addition to that, what we've been working on, so to date, we have exceeded the donations that have come in by almost $7,000 in total expenditures. We've expended close to $20,000 so far in our COVID relief efforts. And we do have a proposal, couple proposals in front of our board as we're moving forward in consideration of future COVID needs. One of them is really more specific to emergency food needs in and throughout our 4 counties. And we, Dr. Michelle Seguin, an employee here who's been leading our food initiative, has been working with many of our food partners, Community Action and the Western UP Food Bank, to look at some solutions for bringing in some additional Feeding America trucks that would be distributed throughout our 4 counties. So we're expecting a fairly substantial bill from that. And then we're also working with some of our local lenders in relation to some of the small business needs. Now, we as a foundation can't donate to our small business community. And that's been discussed and has been talked about both in the past with regard to our flood recovery in 2018 and now with the COVID. But what we can do is the possibility of partnering with other economic development groups or other banking institutions where, if it's needed, we're relying on our lending professionals for input on this. But if it is needed, we may be able to bring some additional monies for those businesses that did not qualify or were not able to access any of the CARES Act or payroll protection monies or whatnot. We are looking at some different models right now of how we might be able to provide some additional support to our small business community.
Yeah, and you touched on a couple of important things there, and I want to talk to you about a few things you kind of touched on there. One of them is just, for a lot of nonprofits, this has to be almost like a nightmare scenario where people aren't out, money's tight everywhere. And so have you guys been providing, besides just monetary relief, have you guys been trying to help advising where to go in the future with some of these nonprofits and what their strategy should be at moving forward?
Well, not just in the case of the COVID response, we try to be an advocate, an ambassador. We try to bring any level of expertise we can to our nonprofit community as they need it. We're willing and able, we're willing to do whatever we're able to do to help our nonprofit partners in their sustainability and their resiliency through times like this. So, in addition to some of the things that we're looking at with regards to any funding support that we're going to be able to bring to that community, I have concerns about many of the agencies that will be impacted financially because of reductions within the state's budget. And as that money gets, appropriated to the different departments, whether it be Department of Community Mental Health or Department of Corrections or whatnot, as that money gets filtered through, by the time it gets down to the nonprofit agencies in our community that are doing, the hands-on, in the trenches work with the people that they serve in our community, there's not a lot of financial resources left. And so this to me is extremely concerning because most of those nonprofits are struggling, with financial resources to begin with. So to add to that, the additional burden or the anxiety of not knowing what next year's budgets may bear for them. But then also, what's happening is, many of them have a substantial reliance on the amount of donations that come into them. And when folks, portfolios are not doing well, and I can tell you last year, with the market as it was, we had our Give Tuesday event as an example at the foundation was just overwhelmingly positive. And that was largely attributed to because people are able to do more. People had the wherewithal. People that had a healthy portfolio were able to look at it and say, I'm able to contribute this back through these nonprofits. And, we expect that there's going to be a little bit of a bump in that donation cycle. We also realize that many of our nonprofit partners, this is the time of year that many of them are doing their annual fundraisers or their spring galas, or they're getting ready to do their big golf outings, and all of those things that are generally used to not only create awareness to the services and the services they provide and the work they do, but really are used as a catalyst to a conduit for that donation stream to come in, has been taken away this year. So I think I think it's prudent that our nonprofits in our community start looking at that, and we're going to work with them to identify what type of budget shortfalls they may be coming up with, and how can we help that in any way that we can.
Another thing you touched on that I want to talk about is the Wi-Fi hotspots, and this is actually a really neat idea with people working remotely, students not being in the traditional schooling sense. Well, why did you guys feel like this was important? I know you guys partnered with a lot of partners around the community to help make this happen. Why did you guys decide that this was the right thing to do during this crisis?
Well, I'll give a little bit of backstory. I was sitting there one evening, and I had an email come in from one of our Houghton County commissioners, Mr. Glenn Anderson, who had a communication from one of our constituents in the community, or citizens in the community, that had expressed their concerns with Wi-Fi access. If you're living in a rural part of the community and you're tapping into your cellular data to use Wi-Fi, you're ramping up your cellular bill, and at exponential cost in many cases. And then what you said, couple that people are working from home and they may not have good Wi-Fi connectivity, or now they have 2 or 3 or 4 or 5 children that are trying to access for their school and don't have good connectivity. And then just taking into consideration the topography of this area. So, that all creates all these different challenges to the rate of connectivity of our households. And I'm not a telecommunications specialist, clearly. But what happened is, because of that, and we looked at it from, the connectivity is an issue of health and access equity for our elderly community that may need to communicate with their primary care physician if there's a chronic illness, or for that person that's maybe working from home but has largely relied on public access Wi-Fi through a library or restaurant or coffee shop, and they go in and they do their work and whatnot. We just recognize that the connectivity, or the absence of connectivity, is a significant detriment to our citizens' ability to be healthy and to be informed. And again, the importance of that information, as well as to be able to continue to conduct work if they need to protect that livelihood, and certainly from the education aspects and the connectivity and the social aspects of it. So we had reached out to, I actually talked to Cori over at Berga Telephone Company, and I just said, I just have this, harebrained idea about creating, some Wi-Fi drive-ins. And he said, we were just talking about that internally. So is this great coincidence of timing? And Cori and Sean and a couple other folks got together with me, and we started talking about how we could possibly create this multi-sector collaboration that would, the outcome would result in having these Wi-Fi drive-in hotspots. And we know, I can tell you right now to your viewers, we know that this is not an overarching cloak that provides Wi-Fi coverage and to the entire community, and it's not that you necessarily can sit in your home and access it, but it is being done in an attempt to create these spots that are more localized. So if you are living in a more rural part of our community, or if you're even in more of our little micro metropolitan communities, Houghton, Hancock, and you need to get access because you maybe can't afford it at home, there's at least these spots that you have publicly accessible Wi-Fi. And, so I can't tell you enough how thankful I am for Berga Telephone Company and Peninsula Fiber Optics, and their willingness to not only, provide all the labor for the installation and maintenance, but also streaming the service and working with us. The foundation is providing the financial resources to buy the hardware. When we did that, we contacted REMC we wanted to make sure, Sean wanted to make sure that the hardware that was being used was consistent with what REMC uses. So if this program goes away, we'll simply donate that hardware to REMC, and they can continue to use it to maintain their school Wi-Fi if needed. But really what we're hopeful for is that this will serve, again, to some extent, to a larger audience, both, UP-wide, statewide, regionally, whatnot, of how when different people from different sectors come together with a common concern, and more importantly, care for a common concern, how you can find solutions to address that issue for our community. And we're really, again, super happy to be able to be part of this, and I can't tell you how thankful I am for our partners, because without them, this never would have happened. Um, and I hope that the community recognizes that those partners have the community's best interests in mind, and are trying to do a good thing with this. So we're pretty excited about it.
You guys do a lot with scholarships and helping out students and stuff like that. I know some have been kind of delayed or pushed back on the timelines and stuff like that. Where do you guys stand at with your general scholarships right now? And what can people expect going forward? Are they still all going to be available? Is there some that are going to be canceled? You want to just explain a little bit more on what you guys are doing with the scholarships?
Sure. It's interesting you bring that up, because we had an expanded program this year. We partnered with the Keweenaw Economic Development Alliance to launch a CTE related scholarship this year. We actually had a very generous donor, Dr. Joseph Kirkish, launched 3 new scholarships this year, named scholarships. So in total, we have we just announced our Make a Difference scholarships at Michigan Tech. Those were announced here in April. We had an incredible cohort of students that came in from our 4 counties. And then our subset of our grants committee met yesterday and went through. We had 153 scholarships applications that our grants committee went through, and they are working right now to announce those. We're looking at up to another $147,000 in educational support this year. So we will be, I haven't gotten the final tally or what the final distribution or awards are going to be, but absolutely our scholarship program is carrying forward. We had, just in spite of the COVID and the break in school, we had a fairly good representation in terms of the applications. And I'll tell you what, going through those applications gives you a lot of hope for our young people. I mean, there are just some incredibly brilliant, talented, and hardworking young people that you get to see when you go through those applications. I mean, it's pretty cool to see what those young people are doing. I don't know where my head was at when I was that age, but it certainly wasn't on the same page as where some of these young kids are today. So we will have some scholarships coming up, and those will be announced and ready for the kids when they go, suits are going to school this fall.
I would like to once again thank Kevin Storr, the Executive Director of the Portage Health Foundation, for joining me and talking about the COVID-19 crisis and what they're doing to help out. And I'd like to thank you for watching In Focus here on ABC 10. You can watch this full episode and all the others on our website at abc10up.com. Stay safe and have a good afternoon.